Greetings. In this presentation, we will discuss how and when to use the American College of Radiology's appropriateness criteria to improve patient care. We will start with a patient case to illustrate the process. A 55-year-old female presents with a chief complaint of a sore breast lump. Her past medical history reveals some risk factors for breast cancer, and her family medical history is significant for breast cancer in a second-degree relative. The physical exam reveals a palpable mass in the left breast. After completing the history and physical exam, it is necessary to order diagnostic imaging to better characterize the mass. What imaging is best for this clinical scenario? To answer this question, we can refer to an empirically based set of guidelines that will assist us in the selection of the most suitable imaging modality for this specific clinical scenario. The appropriateness criteria are evidence-based guidelines to assist referring physicians and other providers in making the most appropriate imaging or treatment decision for a specific clinical condition. By employing these guidelines, providers enhance quality of care and contribute to the most efficacious use of radiology. The guidelines are developed and reviewed annually by expert panels in diagnostic imaging and interventional radiology. Each panel includes leaders in radiology and other specialties. The guidelines are easy to use and an integral tool for evidence-based medicine. In order to access the ACR appropriateness criteria, use this web address or search for ACR appropriateness criteria. You will be taken to this page where you can begin your search. Scroll down until you see this menu. You will be able to search the database by topic, clinical scenario, or procedure. For this case, we will search by topic. Select the appropriate topic from the menu. For our patient, we will choose palpable breast masses. Once you've selected the topic, you will be directed to a page where you can further specify the variant. For our patient, we will choose variant 1, palpable breast mass, female, 40 years of age or older, initial evaluation. Once you've selected the specific variant, the database will generate the relevant appropriateness criteria reference card. At the top of the card are the relevant clinical characteristics: palpable breast mass, female, 40 years of age or older, and initial evaluation. The left column displays various diagnostic imaging modalities ranked by appropriateness based on the selected clinical characteristics. The column to the right depicts appropriateness rating as a numerical value. Radiologic procedures are ranked based on their appropriateness from 1 to 9. A procedure with a rank of 1, 2, or 3 is usually not appropriate. A rank of 4, 5, or 6 may be appropriate, and a rank of 7, 8, or 9 is usually appropriate. The column on the far right indicates relative radiation level of the radiologic procedure. For our patient, diagnostic mammography is the most appropriate radiologic procedure. Note that breast ultrasound receives a score of 4, which is not the most appropriate procedure for the initial evaluation. This reference card is for the same clinical condition, but an alternate variant, wherein the patient has already had a mammogram that was suspicious for malignancy. In this case, ultrasound receives an appropriateness score of 9, as it may be added for further characterization of the mass. Ultrasound may aid in differentiating a cystic lesion from a solid lesion. However, tissue biopsy is needed to confirm the diagnosis. In review, the American College of Radiology's appropriateness criteria is an excellent resource for providers. It's a set of empirically based guidelines that is reviewed and updated annually by an expert panel. Implementation of the appropriateness criteria contributes to the most efficacious use of radiology and enhances the quality of patient care. When the decision to order diagnostic imaging has been made, consult the appropriateness criteria at this web address. Custom tailor your inquiry and search by topic, scenario, or procedure. Choose the most relevant clinical context and variant that best matches your patient presentation. Then select the radiologic procedure with the highest rating.